It's the 21st episode of the Circumcision Chronicles Uncut Podcast. I hope I'm talking to friends of foreskin, because if you're not, if you think cutting babies' genitals is a good idea...
How dare you!
If making a baby boy suffer is on your bucket list, then you better change the channel. Switch to something you might enjoy, like a video about animal cruelty. In this episode, I'll be talking to Dr. John Huber, a mental health professional and a clinical forensic psychologist, and also the host of Mainstream Mental Health Radio. We'll be talking about the psychological harm of circumcision. But before we get to that, this episode is sponsored by Aspire Alpha Armor, skincare for circumcised men. If you're cut, or if your significant other is, get the gift of better sensation at alphaarmor.men. Now, let's get on with it.
Interesting topic. I know we always talk about and hear in the news about different things having to do with body shaming and how it affects people mental health-wise. And we tend to focus on the feminine side of it, you know, the models and how they send unprecedented role models and role expectations to women and try to pigeonhole them into being certain ways. Today, we're looking at a little different perspective, and we're bringing on Anthony Lasquadro. He is the founder and director of Intaction. That's intaction.org. And he founded the organization in an effort to give children a voice over their body anatomy and to raise awareness of the importance of an intact body. Now, Anthony has spoken before the Commonwealth of Massachusetts State Senate, the Joint Committee about circumcision legislation. Mr. Lasquadro often comments on this issue on the media, and so we brought him here today. And with that, I would like to introduce Mr. Anthony Lasquadro. Anthony, come on. How are you doing today?
Hey, Dr. Huber, I'm doing great, and thanks so much for having me on your show. Now, I know I work with lots of doctors, and we talk about things like this all the time, and I know that for some of the doctors, there's a money incentive for that. But for a lot of the doctors, they always say, you know, unless there's a religious reason behind it, they don't see a necessity for that in the most part when we're talking about circumcision. And that's pretty much about what I deal with and know about it. So maybe you can kind of enlighten me and introduce Intaction and what's going on there. Absolutely. Well, you know, you've hit the nail on the head when you said doctors say that this is not necessary. You know, there's a statement out by doctors representing over 20 international medical institutions, and what they say is circumcision fails to meet the commonly accepted criteria for the justification of preventative medical procedures in children. It has no compelling health benefits. It causes pain, has serious long-term consequences, and it violates the Hippocratic Oath of first do no harm. So to have an intact body, to have a foreskin, it's part of who we are. It's the way nature designed us to be. It's a normal, natural, healthy body part, and there's no reason to cut it off of infants and baby boys. So I found it... Medical reason, correct. You know, I founded Intaction to help Americans understand this and do educational advocacy and help them realize it. Because Americans seem to be in their own bubble on this issue, and they think everybody all around the world does this, and nothing could be farther from the truth. Correct.
And so what are some of the benefits of having an intact penis?
Well, it's what we call the foreskin has some important anatomical features, and it's what we call the four powers of foreskin, which is it provides pleasure, protection, lubrication, and connection. The foreskin itself has over 20,000 specialized nerve endings in a structure known as the ridged band. These are special neural sensors that are designed to feel fine touch. And the foreskin provides its own lubrication. It protects the end of the penis the same way your eyelid protects your eye. It's part of the normal human anatomy, and most mammals have this, if not all of them. So it doesn't make any sense to cut it off of a baby for no reason.
So why do you think most people do that? Is just socialization? What's going on?
Well, circumcision has a bizarre history in America. And for the most part, it started in America about 100 years ago by doctors of the day. There was a celebrity doctor, and I'm sure you're familiar with his name, as Dr. Kellogg, the inventor of Kellogg's cornflakes. And Americans at that era were obsessed with stopping masturbation. So they reasoned that by cutting off the foreskin of baby boys, they could reduce that practice. And subsequently after that, doctors found that it became a business. They turned it into a business. And as more and more babies became born in hospitals, doctors initially would automatically circumcise baby boys. It was just a done deal. And then after that, we became a circumcising culture. I mean, in the medical textbooks, they removed the foreskin from anatomical medical textbooks that students would study from. That way they only saw circumcised penises. And this was an indoctrination to make America a circumcision culture.
Wow. Now, I know, in the Jewish tradition that circumcision is part of that religion, and it's done in a religious ceremony with a moil, a specialized priest who does this type of stuff. Do you think that had any impact in what was going on with Kellogg and them, or not?
No, 98% of the circumcisions done in America are done by doctors in hospitals. Christian doctors were some of the biggest promoters of circumcision throughout the last 100 years. So while certainly it's a covenant for people of faith of the Judaic tradition, and Muslims also this is part of their religion. But in America, it was really became a cultural thing. It was never a religious thing in America for people outside of those faiths. Interesting.
So, and you say it's a business. What do you mean it's a business? Are they actually making money off of this, or what you said right when the babies are being delivered, it's just a done deal. So, insurance companies pay for this, or they charge the parents. What's the process?
Well, insurance pays for it. For the most part, private insurance, all the private insurance pays for it, and Medicaid paid for it. Up until recently, where 16 states have dropped Medicaid coverage for circumcision, citing lack of compelling health benefits. But it's doctors can bill this. Look, and when it comes to a hospital, it's all about billable. What can be billed. They have billing experts out on the floors, making sure that every possible thing gets billed out. And this is a money-making thing. Hospitals can charge as much as $2,000 per circumcision.
Wow.
So this is it's a moneymaker, and everything is there. It's a quick procedure, relatively quick, maybe 15 minutes, and it's another billable item. That when that pregnant mother comes to the hospital, she's a profit center for them.
Absolutely. And that's even more than what the doctor told me that they were charging. They were saying that they get $600 or something like that for the proceeding. You're saying up to $2,000. That's incredible.
Yeah, well, I base my numbers on two sources. First of all, there's greater and greater medical transparency these days in terms of billing.
Yes.
And the administration's pushing for even more of that. But I also had access to a database for a very large insurer, and I saw it. The charges were coming in from the hospitals, and they varied from $1,000 to $2,000.
Wow. Well, we talked about some of the positive things for keeping the foreskin intact. What are some of the negatives that happen with individuals in this procedure, or after the procedure, so to speak?
The most significant thing, first of all, is the pain and trauma that an infant is subjected to. You have to understand that infants can't receive anesthesia like an adult would. They're just too fragile for that. So most doctors, believe it or not, even in this day and age, most doctors do not use any anesthesia on an infant that's being circumcised. And it's Contrary to popular belief, it's not a quick snip. This is a 15-minute procedure which involves tearing the foreskin off the glans penis, making a dorsal cut, inserting this clamp which crushes the foreskin, which is necessary to do to stop bleeding or prevent bleeding. And then this clamp has to stay on for a period of time, and then the foreskin is cut off with a scalpel. And then there's the after wound care, and if you ever cut yourself severely, you know how long that burns for. So some doctors may use what's called an EMLA cream, which is a cream that you put on. It's supposed to be a numbing cream. And if I put some on your arm and then I stuck you with a needle, you'd hit the ceiling. It has very little effect. But they can tell the parents we use something. So the babies is subjected to this intense trauma and pain. And, trauma is an exceptional experience in which powerful and dangerous, painful stimuli overwhelm a child. Child is tied down in this contraption. He's spread eagle and he can't move. And they're cutting off part of his genitals after crushing it, essentially. It would be like getting your finger slammed shut in a car door, except we're going to keep the car door slammed shut until the bleeding stops. That's what they do to babies. And doctors that have done these, or residents, or nurses that have been on the floor, they can hear the baby screaming down the hallway.
Wow. Okay, so we have that trauma. The kid's first experience with pain or pleasure in that area is traumatic pain. And what about later on in life? I mean, because, a lot of people argue that most memories for individuals, they don't really develop until around, 2.5 to somewhere between 2.5 and 6 years of age because of the way the brain develops. So let's just assume they're right at this point. What else are we looking at?
Well, let's just back up one moment there. Just because an infant or a child can't recall or remember something, that doesn't mean they're not affected by it. And there have been studies and published statements from notably the American Academy of Pediatrics saying that, I'm going to read it, the prevention of pain in infants is important because exposure to painful stimuli early in life is known to have short and long-term consequences, such as altered brain development, abnormal neurodevelopment, and sensory and stress response systems. So even at the infants will undergo PTSD. They will experience that. And also there's a study out from University of Sheffield that shows a higher incidence of SIDS, which is sudden infant death syndrome, from circumcised babies as opposed to their intact cohorts. And SIDS
I hadn't heard that.
Yeah, and SIDS can have
I had not heard of that.
A number. There can be a number of contributing factors to that, but it seems like circumcision is one of the straws that finally breaks the camel's back. So, and that's the University of Sheffield. I believe it was 2017 that study was released. So, this is what we're putting babies
Well,
to.
I mean, I understand. I understand it does. I'm just saying that, let's just say somebody out there doesn't, understand that. What are some other effects that go on later on in life?
Later on in life, later on in life, there's a psychological impact on circumcised men. There can be feelings of dissatisfaction, they've been harmed. They wonder, why is a scar on their penis? There could be a variety of complications from just a normal circumcision to more serious botches that a young man may have to live with. There's a feeling of being incomplete. There's a feeling of being betrayed by parents, betrayed by doctors. If a young man comes to a realization that he was harmed, it has a shattering effect on his worldview. I mean, it means that if you have to accept a circumcision is harmful, then that means that it was your parents that didn't protect you, the doctors didn't protect you, the legal system didn't protect you, essentially society didn't protect you. And it shatters worldview. It can leave men in a state of depression because anger turns to despair, which turns to depression. Why was this done for me? Maybe they have problems with relationships, and this is one of the causes of that. So this is some of the following. And ultimately, unfortunately, what we've seen, fortunately, it's uncommon, but some young men have committed suicide on this, and they felt that they were in such a deep hole, they couldn't see daylight anymore. And it put them in such a state of depression that They didn't want to live. Our website on the homepage has a number of these real-life stories.
Wow. So how can my listeners find you if they're looking for you or want to find out more about what you're dealing with?
Our website is intaction.org, Intaction. They can contact us through our website. We're also on social media, Facebook, our YouTube channel, our podcast channel. We're out there. We do public events, and we engage people on this, and we're just doing educational advocacy, give people this information. And once they realize it, it's just like, yeah, this is ridiculous what we do to our children. It's more than ridiculous. It's insane.
Absolutely. And, I know you've talked to legislators and things like that. What are some things we can do about this? Just everyday people across the country. What are some things we can do?
The first thing what we can do is educate ourselves on the issue and do some research on it. And then talk to friends and family about it. If you know somebody that's expecting a child, to say, hey, have you researched circumcision? Regardless of whether they know it's a boy or a girl, you want the parents to do the research as early as possible, not when they're in that maternity ward and they give birth to their son, and then you have a doctor who will come in and start pressuring them to do the circumcision. And we've seen this time and time again. So parents have to be in there armed with knowledge, and friends and family can help them with that.
Excellent. Well, if there's any main point that you want my listeners to have, anything you want them to take with them, especially off of this, besides going out and becoming aware and trying to prevent this trauma from happening with new young babies being born, what would that be? You got 1 to 3 points that you want everybody to stick with?
That we were born with an intact body. Nature intended us to have it. Foreskin is there for a reason. We don't cut little girls. We shouldn't cut little boys either. The foreskin and the intact body has some tremendous benefits, and anyone that has one would never countenance the thought of removing it. So, I guess that's the best thing I could leave your listeners with.
Awesome. And thank you for coming on our show today. We've got a different perspective, and I tend to agree with Anthony on this. But it's something we've never brought on the show before, and I'm glad that he's out there talking to the world and educating. Trauma is not a good thing for us. We learn from mistakes, but trauma is something that goes way past what we can learn from it, and it's something we should try and protect everybody from as much as possible, and look out for those little boys coming out into this world, and don't let their first experience be full of pain and trauma like that. And with that, I'd like to remind everybody to listen to us more at Mainstream Mental Health Radio. And remember that life is what happens while you're making plans. So buckle up.